Hello, my name is Peter Lawrence, and I'm pleased to introduce the June issue of the Journal of Vascular Surgery, and to highlight 4 outstanding papers which are freely available for the next 2 months. Our first article of this month is entitled Long-Term Outcome Results After Endovascular Aortoiliac Aneurysm Repair with the Bifurcated Excluder Endoprosthesis by Van Gool and co-authors. They reported on patients with aortic, aortoiliac, or isolated common iliac aneurysms treated with either the original bifurcated excluder endoprosthesis or the recent generation low permeability endoprosthesis. 182 patients with a mean follow-up of approximately 7 years were studied. Survival at 5, 10, and 15 years was 73, 42, and 12%, with no aneurysm-related mortality or survival difference between the original versus a low permeability endoprosthesis group. Freedom from type 1 endoleak at 5 years was 95%, and no new type 1 endoleak was detected beyond 5 years. Also, no type 3 endoleak was identified. The re-intervention-free survival was 84, 67, and 67% at 5, 10, and 15-year follow-up. However, there was a significant difference in the intervention-free survival between the original and the low permeability endoprosthesis group. Although both devices were durable, patients with the low permeability endoprosthesis showed significantly fewer device-related complications and endoleaks. The next article is our editor's choice and CME article of the month. Female gender increases the risk of stroke and readmission after carotid endarterectomy and carotid artery stenting by Goitia et al. During the National Surgical Quality Improvement Program, they evaluated patients who underwent CEA or CAS from 2005 to 2017. Patients were stratified into asymptomatic versus symptomatic groups, and the effect of gender on 30-day outcomes was assessed. 106,500 patients with a carotid endarterectomy in 104,000, or carotid artery stenting in a little over 2,000, with an average age of 71 years, of which 40% were female, underwent either carotid stenting or carotid endarterectomy. In asymptomatic patients, female gender was associated with significantly higher CVA in stroke, readmission, bleeding complications, and urinary tract infection. In symptomatic patients, female gender was associated with significantly higher rates of CVA and stroke, bleeding complications, and urinary tract infections. However, female gender was also associated with a lower rate of pneumonia. The authors concluded that female gender was associated with significantly increased rates of postoperative CVA and stroke in both asymptomatic and symptomatic cohorts, but that female gender was associated with higher rates of CVA and stroke following carotid endarterectomy, but not carotid artery stenting. The next article by D'Oria and co-authors is Frequency and Type of Interval Adverse Events during the waiting period for complex aortic endovascular repair. They performed a retrospective study of all elective patients with complex aortic aneurysms that required a custom-made device. 235 patients had a median waiting time of 106 days. The planned procedures was performed electively in 93%, with a 30-day mortality of 2%. However, 16 adverse events occurred during the waiting period. 10 were aneurysm ruptures, and 6 were cancellation of the procedure due to a non-aneurysm-related death. There were 10 interval deaths, 4 of which were aneurysm-related. The risk of rupture during the waiting period was 6% at 180 days. The median interval from stent graft order to aneurysm rupture was 101 days. Of the 10 aneurysm ruptures that occurred, 6 underwent emergent repair with no mortality. During the waiting period, a substantial proportion of patients experienced adverse events, either related to aneurysm rupture or their underlying comorbidities. The final article by Kirkwood and contributors is Disposable Lightweight Shield Increases Operator Eye and Brain Radiation Doses when attached to safety wear during fluoroscopic guided interventions. Long-term radiation from fluoroscopically guided interventions can cause cataracts and brain tumors in the operator. The authors developed a disposable, lightweight, lead-equivalent shield that can be attached to the operator's eyewear. It conforms to the face and adheres to the surgical mask. In a simulation that was optically stimulated, luminescence nanodot detectors were placed inside the ocular and temporal lobe and midbrain spaces of a head phantom. Wearing the standard leaded eyewear alone did not decrease the operator ocular or brain radiation dose. However, the leaded glasses plus the prototype reduced the radiation dose to the lens, the temporal lobe, and the midbrain by 83, 78, and 75% respectively. The non-leaded glasses plus the prototype also reduced the dose to the lens, temporal lobe, and midbrain. The use of the prototype led to an average operator eye dose reduction of 89%. The authors concluded that attaching the prototype to both leaded and non-leaded glasses significantly decreased the eye and brain radiation. Thank you for watching. For more information, please follow us on social media and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. And remember that these articles are free to read until the end of August. Thank you very much for your attention.